Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use personal protective equipment, such as gloves. The following information represents American Heart Association guidelines and best practices for measuring and improving the basic life support skills of the teams you work with. The successful resuscitation of a patient in cardiac arrest requires a coordinated team effort. Effective teams have providers with well-defined roles, and they work together in a dynamic and timely fashion to prioritize and complete critical tasks. The team leader is responsible for coordinating these tasks and ensuring that clinical care is delivered according to American Heart Association guidelines. Delivering high-quality CPR while minimizing pauses optimizes outcomes after cardiac arrest. But because of competing priorities, it can be difficult for team leaders to continuously monitor and provide feedback on CPR quality. The CPR Coach is a new role within the resuscitation team, and it's designed to address these difficulties and promote the delivery of high-quality CPR. The presence of a CPR coach allows the team leader to focus on other elements of cardiac arrest care. Whether you are a basic life support provider or an advanced life support provider, the role of CPR coach exists to help you and your team deliver high-quality CPR. The most effective way to implement the role of a CPR coach is with a real-time audio-visual feedback device. We'll discuss some of the functions of the CPR coach and how they use feedback devices. First, let's talk about the team layout when using a CPR coach. CPR coaches should stand across from the compressor, always in the compressor's direct line of sight. CPR coaches should also stand next to the CPR feedback display, which is often located on the defibrillator, so that they can effortlessly redirect the compressor's attention to the data provided by the feedback device. Now that the CPR coach is in place, they should verbalize the data from the feedback device, providing corrective and positive feedback, such as push harder or your rate is good.
Great job, you're right on target.
In addition to giving corrective feedback, CPR coaches should give mid-range targets so that providers can focus on a precise metric. An example of this would be coaching the compressor to target a rate of 110 compressions per minute, taking the average between the recommended range of 100 to 120 compressions per minute.
And now you're too fast. Target heart rate is 110.
The CPR coach should also coordinate the initiation of CPR and pauses in CPR. These actions can include initiating CPR, placing a CPR board if needed, analyzing the rhythm, switching compressors, defibrillating, or intubating the patient. The goal of the coach is to keep all pauses to 5 seconds or less when possible.
Switch.
Okay, that VF, go ahead
Hover.
and chart and shock.
Clear. Shock. Resume.
Except for intubation. Intubation should be performed by skilled providers, ideally without stopping compressions.
Okay, through the cords.
But if it's necessary to pause for intubation, the pause must be for 10 seconds or less.
I'm still having trouble. Go ahead and pause CPR. Okay, there we go. Through the cords. Continue.
If intubation can't be accomplished in 10 seconds or less, the team should continue compressions with bag mask ventilation. Being an effective CPR coach takes practice and training. If you'd like to learn more about how you can incorporate the CPR coach role into your resuscitation team, please ask your instructor for more information.